All right, cool. I think we can get started here. Thank you all for joining us for Family First and Beyond. We're going to talk a little prevention in Minnesota. Happy to provide a constructive event to do inside today with all this really gross air that we have outside. So hope everybody's staying in and safe. Let's talk a little prevention. My name is John Kelly. I'm the co-executive director of Fostering Media Connections, which is a national nonprofit that uses the power of media and journalism to lead the conversation about children, youth, and families in America. So just allow me quickly to kind of go over a little bit about us, and then I'll introduce you to this great panel that we're having, and then we'll get started. A couple of programs that we operate here at Fostering Media Connections: the Imprint, which is our daily news source covering child welfare, youth justice, and youth homelessness all over the country. We have several hubs. Minnesota is one of them, where we have a full-time reporter. Fostering Families Today is our bi-monthly magazine for caregivers that goes directly into the homes every other month for foster parents and kinship caregivers all over the country. And then our Youth Voices Rising program works with young people with lived experience all over the country again to engage on things like op-ed writing, more memoir-oriented pieces, public speaking, and all sorts of stuff. And then our new baby here at Fostering Media Connections is Safe Camp Audio, which is the country's first podcast network really dedicated to audio products and content in this space. So you can visit safecampaudio.org to check out all the great shows that we have up there, as well as Safe Camp Audio on social media. We also, last thing I promise, have a bunch of really helpful newsletters. If you don't want to check a homepage every day to find out what we're doing, you can get a kind of monthly dose with our regional newsletters. We just started a Minnesota one called North Star Kids and Families. We have a weekly national newsletter. We have newsletters for the Youth Voices Rising program, Safe Camp Audio, and all that stuff. And I'm just going to quickly stop on this page so you can grab those sign up links. They're all bit.ly, bit.ly/imprint newsletters for all the newsy stuff. YVR is the Youth Voices Rising, and of course, Fostering Families newsletter at the bottom of that. And last but not least, just want a quick shout out to the Sauer Family Foundation, who has been a very staunch supporter of our work in journalism covering child welfare in Minnesota and allowing us to have great discussions like this one. So let's meet the panel that we have put together to talk a little prevention with you guys. Today, we have Bharti Wahi, who is the Deputy Assistant Commissioner of Children and Families at the Minnesota Department of Human Services. For that, she served as Executive Director of the Children's Defense Fund of Minnesota and was one of 15 members in the 2019-21 class of the Annie E. Casey Foundation's Children and Family Fellowship. Bharti, thanks for joining us today. We have Suzanne Arntzen, the Deputy Director of Public Health and Social Services for Scott County. She has over 30 years of experience working in the child welfare field. 25 of those years spent in Scott County, where she started as a child protection worker, moved up into children's mental health case management. And then last but certainly not least, Joanna Woolman is a professor of law at the Mitchell Hamlin School of Law and also leads the Institute to Transform Child Protection. Before all that, she served as an assistant state public defender for Minnesota from 2005 to 2011. So we got this great panel. They're going to talk about different things that they have some specific expertise on. And then we will get into, I have some more kind of like group discussion topics, but we also certainly want to hear from folks in the crowd here, the attendees. So I will we'll go through these guys, have some conversations, and then hopefully have some time at the end to hear from you guys and what questions you have in the attendee crowd. Before we get started with Bharti, I just wanted to go through a couple of just kind of key terms and just some things to know before this conversation, just so we don't have to spend a whole lot of time belaboring that when I'm talking to these guys. The Family First Act, which I'll talk to Bharti about in a minute, was a federal piece of legislation, full name Family First Prevention Services Act. I call it Family First Act. That has several kind of provisions. The two key ones are, creating federal funds to prevent the use of foster care in some child welfare cases. And the way that it does that is we have an entitlement program at the federal level called Title IV-E, It is by far the biggest kind of federal, money flow to the states on child welfare. Historically, had been used almost entirely for foster care and adoption. And now under the Family First Act, they have expanded the kind of scope of 4E to include these preventative services to prevent the use of foster care. Now, what's allowed? It's not just a free-for-all. This is pretty regulated by a clearinghouse that reviews different programs and different models. The ones with the highest ratings or histories of efficacy are approved, and they fall into kind of three groups of fundable models. There's substance abuse treatment, mental health treatment, and parenting skills. This is just generally aimed at families where the child is deemed to be at imminent risk of entering foster care. I'm not going to go too much into the rest of Family First right now. We can talk about it if we have time later. But it's sort of on the other end. It limits federal money for congregate care. That's like group homes and institutions. And then also, I will stop just quickly on this to raise up, because I will ask Marty about it later. Kinship navigators. Kinship navigators are kind of a one-stop shop for relatives, loved ones, neighbors who take in children. The idea being that these can be kind of this one-stop shop to refer people to help them enroll in benefits that they might be eligible for, just have kind of group rep sessions, respite care, all kinds of stuff like that. And that is also, now federally fundable through the 4E program. So that's Family First. Family Resource Centers. We're going to talk to Suzanne about that and their work in Scott County to kind of build these up. They are often based in the community or at schools. The services can include parent supports, connections to resources, child development opportunities and programs. The goal of Family Resource Centers, which vary in name from different places, is to build strong families and lower the likelihood of child maltreatment. If you are interested in learning more about Family Resource Centers more broadly, you should check out the National Family Support Network's website at nationalfamilysupportnetwork.org. Last one, then we can get to Barty. Parent right to counsel. I'm glad that Joanna joins us today, because I don't think this is always talked about kind of in the context of prevention work. But I think a lot of people outside the child welfare fray would be surprised to know that there's just simply not a guarantee, in the same way as criminal court, that everybody involved in these cases, youth, parents, everybody, have this access to counsel. In fact, there are 12 states at least that make it conditional or discretionary for that to happen. Even in the states where there is a guarantee of counsel, that is not guaranteed to start right at the beginning of a case. You might, in some states, not be guaranteed counsel until you're facing a termination of parental rights. And then last thing, and then we can move on. Right around the same time that the Family First Act was becoming law, a very large 100-page bill with lots of different changes to federal entitlements. The federal government also kind of quietly changed 4E rules to allow states to tap into entitlement money to help pay for legal costs. And that was a big deal. It was the first time that had ever been offered. So now states can essentially go and look for about 50% of the funding to pay for legal costs to provide attorneys to both children and parents involved in cases. So that was all by way of just kind of creating a little primer for some of the things that we're going to talk about. I'm going to stop sharing this screen. So now I can see the chat on the side. And that's the last thing I wanted to mention is, again, throw your questions into chats or comments in there, and I will do my best at the end to round up what I can. So Barty, let's start with you, and let's start with the Family First Act. I wonder if we can just begin by talking about, and forgive me, it could very well be the case that maybe you weren't there for the entirety of the process. I know you're relatively new to DHS, but just talk a little bit about the way in which DHS came at the question of how are we going to build our prevention services plan, what's going to go in it, who was involved in making those decisions and all that.
Thanks, John. So, I mean, I think that's a really a great question, because I think this represents probably one of the more significant changes to child welfare policy at the federal level, in addition to some of the changes that have happened around residential treatment. But in September of 2022. So yes, I will totally own that. I was, for the most part, a majority of this time, actually the executive director of the Children's Defense Fund of Minnesota, so wasn't with the state. However, the department had been working with county and tribes around some of the prevention, just to identify some of the key components of what should be included in a prevention plan. I think that really sort of came together more fully under our Assistant Commissioner Tiki Brown. And in September 30th of 2022, we submitted our prevention plan to the federal government for approval. And, as you said in the start of this, while there is a lot of excitement around the possible investment in prevention services to get sort of, if one thinks about the continuum of services and care, more greater investment on the front end, right? I think that it is, as you said, pretty well regulated. So there is a sort of rigorous, there is a rigorous kind of clearinghouse process as programs are identified to be eligible for this 4A reimbursement. That clearinghouse is run through the federal government. And so, part of the conversations that we have been having here in Minnesota is the identification of sort of some clearinghouse ready, if you will, prevention programs that could be ready for reimbursement. And, one thing I just want to sort of start by acknowledging that, like, we also recognize that there are a lot of prevention programs and services that fall outside of the clearinghouse strategy. We know that the issue of culture and cultural relevance in these matters is not necessarily always fully present in some of those prevention strategies. So in addition to sort of developing this plan for federal approval, which identified motivational interviewing and parents as teachers as, I think, some initial prevention programs, we are working with all of our 11 tribes here in the state of Minnesota to identify and have been able to use some Family First Transition Act funds, which were made available to states as they were testing and implementing these strategies. And so we are working with our tribal partners in the Tribal Training Certification Program through the University of Minnesota Duluth to help also further identify some of the more culturally rooted practices as well. I think I would also just add, in the context of this plan development, it's certainly not without bumps, and we had a pretty challenging global pandemic in the middle of that process. So I think despite the plan being submitted, we continue to work closely with our county partners, community partners, and tribal partners, because the plan is not one and done. It is, there's opportunity for further refinement. The plan was approved through the federal government in January, but we continue to work on what would the process of developing the process to develop a 4E claiming process, if you will, for those services themselves, and just also acknowledging that those two programs are not the only. There are other, as further programs are making their way through the clearinghouse, there may be further opportunity to implement those and to incorporate them in the Minnesota plan. So it is an iterative document.
Let's talk about those two programs, but Barty brought up something I should probably said in the kind of preamble, which is like the clearinghouse creates this whole menu of options that are fundable, right? They do all the review, declare this thing to be, of enough evidence to be funded through. Or it's still, the states still have to, just like Minnesota did and many other states have, submit this plan and say, we are intending to use this, and this service. You can't just, start willy-nilly claiming for all of them. So that's what she was talking about as she was talking about like preparing a plan. So the outcome of this first plan for you guys was to seek approval for motivational interviewing and parents as teachers. Can you describe those two models and talk a little bit about kind of why they surfaced as the most critical to start with, in your guys' opinion?
Sure. And just to sort of like with the goals with the plan, I mean, obviously there are to improve the health and well-being of families, reducing incidents of maltreatment, and keeping, children with their families, which is the goal, one of the primary goals of Family First. Reducing initial entry or reentry into the foster care system. I think here in Minnesota, we know that we are contending with disproportionality of American Indian and Alaska Native children, as well as African American and Black children, as well as children identifying two and more races in the child welfare system. So really thinking about how we can hone in on that. We wanted to strengthen and standardize expectations of policies and practices, and then be responsive, right? And it's a new way of investing in prevention. And so, I think in the context of motivational interviewing and parents as teachers, both were clearinghouse ready, right? So I think we were starting with what was the menu or the universe of possibility, those constellation of programs. Parents as teachers is also a program that is sort of intersectional in nature. It is tied to public health. I myself have implemented that program when I did home visiting in a past life in direct service. So really making connections between both parent support and then also sort of our connection with our public health partners. And I think that's one of the reasons that program sort of rose to the top. And then I think with a motivational interviewing, we also have, I think, a number of counties and others who are implementing some elements of motivational interviewing. So it's also just about like, what can we move on a little bit more quickly as we continue to build out, I think, a robust sort of vision and plan for prevention services generally. Not just that which is clearinghouse eligible, but I think there's an opportunity for us to be thinking a little more expansively about what really helps families, supports families across that continuum.
Gotcha. Yeah, you mentioned, kind of being in continuous conversation with tribes about, what may come next with Family First and other prevention strategies. And I think in the plan, you guys kind of call out that while Family Spirit, which is really I think still the only kind of indigenous rooted program that's been approved by the clearinghouse, while it did make it into this plan, you guys kind of called it out in your plan as something that you're going to be talking about and working on implementing in the future. Hate to put you on the spot with this, but are there any particular other programs that you have your eye on as Minnesota gets where? I mean, let's put it this way: are there aspects of the Family First continuum that you're particularly interested in adding next? And when you think about it in terms of like substance abuse, mental health, parenting supports, anything you feel like you guys want to prioritize next?
Well, I'll be honest with you, and I think Suzanne, as one of our implementation partners, can appreciate this. Like, we're trying to get this one moved up and out the door. We're still working with the federal government around the process for 4A claiming. I mean, not to get too weedy, but there's a whole cost modeling process that needs to be approved through the feds. That is also like, how can we even just get these resources out the door? So I think our focus has been there, but I think we are definitely, because there is an interest to really think about Family Spirit. Like, that was another one of those components. I think that there are also other strategies that I think counties have and tribes have been implementing or using funding through other spaces and places. And I think as we continue as things continue to move through the clearinghouse process at the federal level, because things are coming online all the time, I think that's some space and place in which we are continuing to do. But I'll just, in all honesty, we're really focused on right now. The plan got approved. We're working on that cost, the cost allocation process with the feds. And then I think just trying to get these pieces moving and out the door so that folks can be ready to claim.
Sure. Yeah. This way, kind of maybe a little bit of a weedy question, but I think it's kind of an important one, because this is certainly a pattern that you see across the states and what they've elected to go with first. So motivational interviewing, parents as teachers, they have the highest rating of efficacy. They're both rated well supported. It's definitely the case that Minnesota is definitely not alone in only having chosen well supported. Most states have really loaded up on that, and so far really haven't picked much in that promising or even in the supported bucket. And I noticed in your plan and several others kind of noting the maybe, well, correct me if I'm wrong, but I kind of picked up on a level of uncertainty around what the state's obligation would be to like do these evaluations and track that stuff. Is that something that you guys like feel like you need more federal guidance on? Are people a little hesitant to jump into, bringing in a service where they're like, I don't know how much it's going to cost or how we're going to do the, evaluations we're required to do? Or am I way off on that?
Well, I mean, I think this is a new policy. It's new for the federal government too.
Sure.
So
Yeah.
there are just a fair number of unknowns. And again, not to belabor the point, but there was that weird global pandemic in the middle of this, right? So, I mean, I just think that like it's sort of slowed some of those things down as people were kind of contending with the emergency. So, I mean, I think for us, I think it's sort of the tension between um, what could we move on more quickly than not, right? Where there would be maybe some of the least amount of uncertainty, while at the same time, I think, and as we build the system out, because we're building here in Minnesota, counties and tribes are building, and I think the feds are building too. Um, but I do want to acknowledge that I think there are a number of other programs that that are every day coming into the clearinghouse process. There are many that are not there, right? And I think what we're also trying to identify, and not without bumps and not, slowly and probably more slowly than others wish it. I think that there are other ways that we can be thinking about prevention. And I think as we lean into what Family First makes available to us, we can also see what else would we like to do, right? And I think there's a number of opportunities for us to be thinking in that way.
Great. Last one in that vein, and then you're off the hot seat, and we'll talk to Suzanne a little bit about family resource centers. But to your point, like you guys put this plan in a while back. It just got approved in January. I think since then, almost there. I think probably at the time you guys submitted that plan, there were no kinship navigator models that had been approved for use. Now, my understanding is there is not currently a kinship navigator model in Minnesota. Are you guys thinking that you might pursue one of these 3 or 4 that have been approved now since then? Or, is DHS more thinking of how to set up, a more homegrown Minnesota kinship navigator program? Well, how are you guys thinking about that?
Right. So, I mean, it's, I think, a really good question. I mean, I think we are absolutely working on how we can approach kinship navigation, what will be available through the feds. You're 100% correct that like, even as we speak, there are more things that are running through that model, and there are models across the country that are being implemented. I will say that Minnesota has been working on kinship navigation. The department has contracted with Lutheran Social Services in Minnesota, and we did that in 2021 to develop and enhance and evaluate kinship support. Okay. Kind of in preparation for the potential 4E, prevention services clearinghouse submission. We have been moving in that direction. We also are doing some work with our county partners and our tribal partners to identify, now as things are coming online, if you will, through the feds, and we're starting to look and talk with other states around some of the other models that they are implementing. And I think we're right in that place of trying to identify, this is a really key area of support and that is necessary for families. I think Suzanne is going to talk about family resource centers, which she knows are very close to my heart as well. But I think that kinship navigation support is really important to the success of families across the continuum. It's a real priority for us, and we've put some resources in it, but as more things have come online, we're working with a number of partners to see what might be the best strategy as we are in this initial and early phase.
Okay. All right, with that, let's go to the county level. So Suzanne, family resource centers have been around for quite a while. There's been this kind of, I feel like, a new energy of late around them in the past few years. I think obviously that's fueled by, more interest in connecting families to any help they need before it reaches this kind of point of crisis where foster care entries come in, open cases come in. So Scott County is kind of an early adopter on this model in Minnesota. How did you guys get interested in FRCs? Like how did Scott County first kind of come to this as a piece of their strategy?
Sure. Thanks, John. Happy to be here and really excited, I think, to talk about our Family Resource Center work. But I also want to couch it in our Family Resource Center work is really around the umbrella of building out community-based supports, and FRCs is a key component. And that work really started back in probably 2017. Minnesota was just as a system coming out of the governor's task force on the protection of children. And we saw some pretty substantial system transformation or system change. And I think for us in Scott County, although we are not alone, we saw pretty substantial increases in the number of reports coming into child protection, the number of assessments and investigations. And most concerning is the number of kids who were ending up in out-of-home placements and going to permanency away from their families. And that was all happening at the time that our county board was engaging in some strategic planning. And as we shared the data and the trends, our county board really established sort of a bold goal of how do we end the need for child protection in our community. And so that work really launched a partnership between child welfare and our public health to say, how do we engage our community to help really understand, one, share the information, so they clearly could understand and see what was happening, and two, engage them in what did they see as strong and supportive of kids and families, and where did they see system gaps. So that work went on for really the 2017, 2018. And then that led to the development of a strategic plan focused on ending child abuse and neglect within Scott County within a generation. And so to operationalize that, then we've really developed a community-driven initiative that we've branded Together We Can, which consists of community members, community professionals, Scott County staff, who are all coming together to research essentially what are different parts of community-based prevention that can be implemented in our community. Family resource centers were one of those multi-generational approaches to serving families differently. So that's how we got there. But I want to go back to when we engaged our community, because really in hindsight, what I can say is in one of our community meetings, community conversations, I had really the privilege to meet with 3 Latinx young moms following the big meeting. And they talked really just innocently and purely about the challenges of being a young parent with young children and being poor. And one mom really passionately talked about, I have to walk 2 miles with my infant in a car seat to go apply for this service. And then I got to walk another 1.5 miles to go apply for this service. And her friend then very innocently says, don't you have a place that we can go to one place and get access to all of those services? And I didn't know how profound that was at the time. Certainly now that we are in the Family Resource Center, we've successfully launched, that was really the seed that was planted that we have grown now over time to where we have launched our Family Resource Centers.
Very cool. Now, I know that the sort of top line answer is that it varies widely, but I do think it would help for people listening to kind of understand or be able to visualize how somebody would come to interact with this. So maybe you could take us, you don't have to use a real person, but just hypothetically, how does somebody find out about your resource centers? Where do they go? What are these things that you're talking about them connecting to? Give me just the biggest example of what somebody could find and avail themselves of at the centers.
Yeah, well, you're right. It varies widely. So there's one example where we could take county services, someone coming out of a county jail, someone involved in child protection, and they may make referrals directly to the Family Resource Center or bring a family in. We had a child protection case where the worker, as part of an investigation, it was a single mom of 8 children, brings them in to the Family Resource Center. And then that service navigation really started. And it was everything from emergency housing assistance, because they were about to be homeless. It was food support. It was mental health services and evaluation for some of the kids. And so that really, those referrals started at that very moment. So again, it can come from formal services. We are getting referrals from obviously schools when schools are in session. So we've done specific outreach to schools to make sure that they are aware of how do we move. And this is again, part of that umbrella of community-based prevention how do we create a culture of mandated supporting, not just mandated reporting? And so making sure that we've got our mandated reporters and community members aware of family resource centers being a way to connect families at the earliest point possible. So schools make referrals. What we are most excited about is if John Kelly and his family come into the Family Resource Center, 2 days from now, we might have John Kelly's neighbor or sister who are also now coming into the Family Resource Center because they've heard it's safe, it's welcoming, they have access to the needed services and supports. So there's tangible, concrete supports that are provided. It can be emergency assistance, it can be housing supports, but then we also have really parenting curriculum courses. We have a father's group. We have about 36 partners who really all come in and come together to say, how do we serve families in a new and different way, organized out of unique universal sites within our county.
How, as this is kind of like a relatively new endeavor, have you thought about like how will you know these are having an impact? Like what, if anything, do you intend as a county to kind of measure and track to see what in 5 years you can say, we did this and it worked? What will that metrics be for you?
Yeah, I think that those are great questions. Certainly the idea of program evaluation, and I can certainly say from our county leadership, when we implement, we want outcomes today, right? We want to do something and see outcomes, and sometimes those outcomes take some time. Things that we certainly early indicators, one, we are reaching families, we are reaching communities that we have not historically reached. So we've got cultural navigators. So we have people who look like our community in a way that county and government services don't. And so we are reaching underserved communities. So just from utilization for the first 5 months of this year, we've reached just about 1,500 families and are connecting about 400 families with actually concrete services or ongoing supports. So utilization numbers and trends, we are certainly looking at both from a demographic and age, population based. And then it is some of our child welfare trends. So as we really started getting into serious prevention implementation, so Family Resource Centers, some of our school attendance concern programs, it has been, what are those trends overall? Are we seeing differences? And so we are seeing reductions in reports. We are beginning to see reductions in assessments, and we're seeing reductions in out-of-home placement. Other targets we look at for our community, third grade reading is a significant piece that we track in partnership with our schools. And so we look back at, okay, what positions third grade reading, certainly early childhood screening. So there's some markers that we're looking at around education and awareness for making sure that families are aware of resources for screening. And then does that impact long-term reading at third grade?
Who is actually on a day-to-day basis operating the family reporting centers? Is it the county, or do you guys kind of do it through a contract with a local provider? How does that work?
The answer is yes. So the county, and then we have got contracted partners that so one night it might just be county staff. The next night it might be a county staff and some of our cultural navigation partners. And so it really is a variety of people who might be there at any given time. There's a core group, but it is not solely and specifically county staff.
Let's say, I mean, the reason I ask that is because, well, it sounds from how you're describing it, like you guys are trying to train mandated reporters in the community that this is an option for them, almost as instead of a hotline call in some cases. The reality is that if there's county people there are people that are actually at the centers who are themselves mandated reporters. That's certainly been a concern in some places about the Family Resource Center concept being managed by the same agency or county, social services department that also has the right to go in and investigate and take children away, right? So have you, like, as you were building it, had you discussed that? Have you heard those concerns in the community? How do you communicate with families about that if they have concerns?
Yeah, well, it's something we're very thoughtful. Like, we are probably one of a couple where it's really more either city or local government that are operating FRCs. And so we were cognizant of that at the onset. Our goal remains, we've got sort of a roadmap that we are looking, how do we spin this off to a nonprofit by end of 2025, so that government can continue to be a partner, but not a driver. That really the goal is, how do we sort of help build something and then look at sustainability via community-based partners to help sustain it over time. So that's sort of the long term. Certainly in the midterm, John, we are certainly aware of the concerns. We've tried to be, I think, transparent with community and families. It is a Scott County, like our Shakopee site is a Scott County building, but we've intentionally designed it and have partners present so that it has hopefully a different look and feel. Now, people are still mandated reporters. We have not had families express concern, but families they're not required to provide information. We ask them to check in if they want to, great. If they don't, they don't. They're not part of our state information system. We've worked hard to try to separate to the greatest degree possible.
Gotcha. Okay, from there to the courtroom, or hopefully stay out of courtrooms. We have Joanna. Thanks for being patient. Somebody always has to go last. We've heard from these two leaders, about direct services and supports that are aimed at prevention. Let's talk about where legal counsel fits into this picture, because I just don't think people always conceive of the legal support as a preventative strategy. But let's start with like your work in general, Joanna. Can you tell people a little bit who may not know what you guys do at the Institute and what the kind of mission is of the Institute?
Sure, it's nice to see everyone today. So the Institute to Transform Child Protection is housed at Mitchell Hamlin School of Law, which is in St. Paul, Minnesota. And we focus primarily on 3 arenas. We do a significant amount of policy work. We advocate for system reform and legislative reform at the Minnesota legislature and nationally. We provide training to system partners across a wide swath. So we train attorneys and judges and other stakeholders, social workers. In particular, we provide significant training in Minnesota and around the country on mandated reporting. And we run a law clinic, an interdisciplinary law clinic, where we provide direct representation to parents and relatives who are impacted by the child welfare system.
So on that note, and this is something that you guys were kind of front and center on advocating for, there was a pretty significant change in law there in Minnesota as a few years ago about the provision of counsel to parents. Can you explain the before and after? What was the situation in Minnesota as far as right to counsel, and what is it now?
Sure. Minnesota, like many states, prior to 2023, had a discretionary right to counsel for parent attorneys. So starting at the biggest level, there's no constitutional right to counsel in a termination case. There's a terrible Supreme Court case called Lassiter versus the Department of Social Services, where the United States Supreme Court said, because this is a civil case and not a criminal case, there's no constitutional right to an attorney when you're facing the risk of losing your child. That left the decision about whether or not to provide lawyers to parents to each state. A lot of states made the decision to create a right within their own state statutes to counsel for indigent parents. Minnesota did not do that. We had a statute prior to the change that said it was up to the discretion of the judge. And our language literally said if the judge felt it was appropriate to appoint an attorney, a parent could get appointed an attorney in Minnesota. Many counties did appoint counsel to indigent parents, but that representation was extremely inconsistent. So I would say data is really hard to get in Minnesota, but probably in close to half of the counties in Minnesota, there was not an attorney at an initial appearance for either a custodial or a non-custodial parent. And that, of course, is the hearing where the constitutionality of the removal of that child is being contemplated. And so for hundreds of parents in Minnesota, they were attending that initial hearing without legal representation. We worked for many years, over a decade, to bring reform to our statute, and were able in 2021 to pass that new law. And so now every parent in Minnesota, both custodial and non-custodial parents, have a right to counsel. And that's a mandatory right to counsel that counties have to provide. And that counsel now attaches at all parts of the proceedings. So theoretically, it could attach to work prior to a removal in a pre-petition situation. It certainly attaches to the emergency removal hearing, and it continues through the right to appeal. And I would also just mention, so that legislative change occurred in 2021. That law went live in January of 2023. As a sort of follow-up part to that, this last session, we were able to work collaboratively with Representative Jamie Becker-Finn here, a great advocate in our state legislature, to create a new office, a new administrative office in Minnesota that will be providing counsel for appellate representation to all parents in Minnesota, including tribal courts as well.
Wow. So I want to go back to something you just said there, because I do think it kind of pertains to this. The way that the new law is written, would it be accurate to say at a minimum, it guarantees counsel at the point where you're having a hearing over your child going into foster care?
Yes.
But you believe it could also be interpreted and implemented as at the point of investigation? There would be the right to counsel?
Absolutely. Yeah. I mean, I think that in situations where you have people voluntarily working with the county who are at risk of their child being removed, I would interpret this statute as applying there. We only have one sort of formal pre-petition legal services program. The Adult Representation Services office in Minneapolis, our biggest city and biggest county, has a pilot program running right now. My hope is that as a part of Family First and looking at prevention, that model could be expanded to more places in Minnesota.
Yeah, so that's like the triangulation, right? Is that if we had am I correct in thinking your feeling would be that presence of counsel early in cases would guarantee that more plans were built around the types of things that Family First now funds as the list of services gets bigger, or no?
That would be wonderful. I think that legal counsel could be hugely important. And I mean, not in an adversarial sense. There's a lot of families. I think one arena in Minnesota where we see a lot of removals that I think could be prevented is in the area of SUD or substance abuse disorder, and pregnant people using either during or immediately after pregnancy. And I think that access to treatment, access to stable housing, those sorts of things, situations where you have intimate partner violence and need support around orders for protection. There's all kinds of arenas where an attorney could be helpful in preventing a removal.
Yeah. In your experience working with clients, you mentioned SCD, but also, what services or supports do you find that parents most needed in order to avoid a family separation? I guess in a lot of cases you're talking about them in hindsight, but what comes to mind as the things they most voice needing?
Certainly meaningful drug treatment, I think, across the country, but certainly in Minnesota, opportunities to remain with their children in treatment. So cohabitating treatment facilities is a huge gap in services. But meaningful drug treatment across Minnesota is a huge issue. In our rural counties in particular, I mean, there are a lot of situations that we anecdotally hear about where parents aren't able to get into treatment programs for several months, and because of our timelines, are sometimes losing their parental rights because they can't complete their case plan. But the impossibility of getting into treatment is the main barrier. So certainly effective and available drug treatment. I also think sort of getting out of the black box of services that many counties sort of allow parents to use and broadening the scope, especially around therapeutic services. So, thinking about culturally appropriate therapy for our immigrant communities, in particular in areas where there may not be many resources that sort of speak their language or understand their cultural norms. That's another issue that I think comes up a lot. Those would be two main ones, I think.
Yeah. So I mentioned, as we were kind of getting folks acclimated to what we're going to talk about, the very quiet change in federal policy that opened up the spigot a bit for 4E money to go towards legal costs. Has Minnesota taken advantage of that offer yet? And if not, how would you like to see it done? Because the states have some discretion, I think, in how to, make that offer to counties and other people.
Yeah, I think unfortunately we really haven't taken advantage of that to the extent we could. There's I think one county utilizing Title 4E in Minnesota that I am aware of. We have largely left that unutilized. So, and I think there's been a lot of requests from various counties Certainly, I've been in communication in the last year with many tribes. I think we're really leaving a lot of money on the table to support our 11 tribes in Minnesota. I would love to see a lot more emphasis and work done in Minnesota to access Title IV funding. And I think the passing of the new bill around the appellate office sort of rejuvenated some of those conversations. There's been quite a few folks reaching out to me over the last few months, really curious about why this isn't happening in Minnesota and how, in particular, tribes can start accessing this funding. So I think there's some work to do, but I'm hopeful that that the administration and certainly, you know, Barty and her folks can continue that work.
But Barty, not to make you the spokesperson for all operations at DHS, but I'll put you on the spot enough to just ask: is that something that you guys are talking about and thinking through how Minnesota could avail itself of the split on costs for legal?
We are actually, and because I knew Joanna was going to be here, I dug in, right? Joanna's right. We have piloted with one county. Hennepin County has been that, and I will say it's been a process for us as well. And working with the feds, it took almost 2 years to get federal approval for the cost allocation for that claiming. You know, I think some of those matters have slowed us down in a kind of way, but I think the state is very interested and in bringing those resources here for this effort. In addition to Hennepin County, hold on, I like literally wrote it down. Jenna, where did I put it? You know, I think what we also have are 3 counties that are, or 2 additional counties that are like in the process. I think they haven't claimed a lot, but Mille Lacs and Crow Wing have also come on along. So we are in the last year moving to those additions, and appreciate Hennepin County's partnership as we kind of worked out the kinks in the claiming process itself. And then we have a number of additional that are in the process of working through agreement. So we're absolutely doing some of that work. With regards to our tribal partners, there's a little, you know, with tribal courts, there's a slightly different sort of set of considerations. And so we've started the process of what that would look like as well. So, I mean, I think the state is very interested in moving forward and appreciate Joanna's advocacy in this area. You know, I think we all, you know, if we can bring the resource here to help support folks, I think that's definitely our desire. And just working through some of the, you know, my team teases me often, the tricky wickets around some of the claiming issues, you know, as we continue to move those resources and make them available.
I think it'll be interesting to see uptake, you know, after, if and when you guys get it up and running. I think this kind of bowled me over, but we did a little bit of research into expenditures on that for illegal. Where we haven't really published anything about this yet, but so sneak preview of a probably future story here. You know, we got from every state that's kind of implemented this already. How much have you know, gotten from the federal government for this? And it's more than has been drawn down for Family First as of 2022. Now, I kind of expect that, you know, Family First will go up as more states get implemented. But, you know, it seemed like, you know, states that took this on have seen interest from counties and whatnot. Joanna, one last question for you, and then I'm cognizant that we have about 10 minutes left, so I'll try to get some attendee questions after that. But it kind of occurs to me that the legal equivalent of what Suzanne is doing in Scott County with the Family Resource Centers is actually not the council we're talking about. It would be like what some people refer to as civil legal advocacy, right? Like representing parents on issues that can then eventually trigger, you know, child welfare involvement. And, you know, our mutual friend Vivek Sankaran built that mousetrap a bit in Michigan. Anybody kicking the tires on that in Minnesota? You guys have designs on doing that at the Institute at all, or what's up with that?
Yeah, I mean, so we do have a Equal Justice Works fellow starting who's going to be focusing on doing some pre-petition work. And I have done some partnership in Ramsey County around some of these issues. I mean, I think that So yes, for sure. I think we're definitely interested in exploring that with our community partners locally in St. Paul and Hennepin County. One of the things I think that's really critical, though, that Suzanne mentioned, and I think is sort of the key to the success of a lot of these issues, is really this idea of like decoupling access to services from child welfare and state intervention, right? And so that is true for the family resource centers. If we can, and we hear that, we do a lot of work with doctors and hospitals around women who are using, if we can figure out ways to divert people to services that don't involve state intervention, I think that we're going to have the most success in decreasing the number of families impacted and children impacted by the child welfare system. And so certainly I think there's a legal equivalent to doing that, to referring people to lawyers for other civil legal issues that will help them avoid child welfare involvement. And that can also include just like family law itself, right? Delegation of parental authority forms, or figuring out transfers of custody that may make sense for folks who have longer term struggles that they're dealing with.
Yeah, thank you for that. So we'll go to, I'm going to scan through the chat here to see if anybody's got some good questions for you guys. Christine Peterson, data analyst, asked, I don't know, this one's for anybody that wants to take a bite out of it. I'm curious about the intersection of Family First, the Family First Act, and the Adoption and Safe Families Act. Now, just for context, for people that don't know, the Adoption and Safe Families Act was passed in the late 90s, and it set, it did other things, but it set a timeline on which states are, with some pretty notable exceptions, obligated to initiate a termination of parental rights and move towards other forms of permanency if a child's been in foster care for 15 out of the last 22 months. I'll throw this out there to anybody, but I guess I'll go first and say I'm not sure there's a lot of tether between those two, because I kind of view them as being on the different sides of the continuum. Nothing is coming to mind for me in terms of what the provisions and caveats of Family First, how they would be connected much to the Adoption and Safe Families Act. Anybody else have thoughts? Tell me I'm wrong. I'm wide open to that.
Well, if we were able to be really successful with Family First and really ramp up prevention to the point where we didn't need as much child welfare, maybe we could get rid of ASFA, get rid of it altogether and replace it with Family First.
Right.
Then they would be sort of related.
One would, yes, cause the downfall of the other. Mana Salter asks, I'm going to start with you on this one, Suzanne. How is the resource center a safer space? How is the threat of removal reduced by use of them? What would you say to that?
I think some, but just the physical layout, right? It doesn't look, generally speaking. We are co-located for 2 of our sites. We are co-located food shelf, library. So they are universal spots where families may just generally find themselves. So it's not coming into the Scott County Government Center to access services. And again, we're really intentional about who is at the center, designed to help people. Ideally trying to, again, have the staff at the Family Resource Center be, if not solely, but partnered then with county staff. So we might have contracted providers who provide culturally specific supports and resource navigation with the county staff who are helping families navigate those resources, again, outside of a government building.
Gotcha. Jay, this is not a question, but Jay Warner just rung in to say they have a demonstration project in Wisconsin called Family Legal Advocacy Services, available to families with legal issues that may leave families at risk for child welfare involvement through the UW-Madison Law School. So that is what we were talking about with civil legal advocacy. Alana Spector wrote, as a CASA, so that's court-appointed special advocates, I love the idea of proactivity, but a huge challenge is getting the parents to avail themselves of offered services. How have you motivated parents to participate? I'll start with you, Bharti, on that, because I think motivational interviewing is a model sort of aimed at that, right? To some extent.
Yeah, I mean, I think that, I think programming that feels relevant to families is what, so I appreciate what Suzanne and others are doing, because I think if it feels relevant to families, they're going to avail themselves to particularly those services that, can help. I think, it's also just, I think both Jonna and Suzanne talked about different types of community partnerships. Meeting families where they are at is one way that we are thinking about that with parents as teachers, right? That's a different set of partnerships. Am I, having some county components of it? So I think just trying to meet families where they might be to proactively think about that. And also thinking how it leverages, I do work at the Department of Children and Family Services, and prevention services can look like concrete supports, they can look like parenting supports, right? And I think, thinking about how we create stronger alignments with other aspects of support services to families, right? So I think those are some of the things that initial thoughts that I have when I think about what makes them. I would also say cultural relevance, linguistic responsiveness are also really core components that really can help bring families to the work. If they see somebody from their community, to Suzanne's point, I think are all really important as well.
Yeah. Stacy Geringer. Oh, hey, Stacy. I know you. Are there parent partner peer support programs that are gaining momentum in Minnesota, something similar to Washington State? I know we have One Stop and a CP clinic, but can funds be used for parent partners in addition to legal help? Joanna vigorously nodding. So I think.
Yeah, it can be used for all aspects of an interdisciplinary team. So if you look at states like Washington, Iowa, Colorado is a great example. They are using Title IV funding to fund really robust statewide parent mentor and interdisciplinary practice, allowing social workers as well to work with family defenders. So for sure, that's an option.
And John, if I could, I just might add, so we've got peer recovery specialists and family peers that are working out, again, through partnership, working out of the Family Resource Center. So for anyone who comes in, if there's a peer there, that's accessible to them at no cost.
I want to ask this because it does kind of relate to it. It's like one of those things that ties into all of the things we were talking about. And I don't want to end on a down note because this will probably be the last question. But workforce is such a big issue always in child welfare. And at least some places, we're at like blinking red light status in a couple of states and counties. What's the situation in Minnesota from your guys, respective vantage points? Because obviously it goes without saying, if you can't find if you don't have enough people doing meaningful substance abuse treatment, or people that want to be peer support workers or caseworkers or lawyers, everything we're talking about is kind of for naught if you don't have that. So if maybe you guys could quickly kind of go down the line and say, where are things with workforce? You may call on. I'll call Barty. Start with you.
Yeah, no, I mean, I think that there's a workforce issue at almost every level. I know that our county partners and our community partners, our tribal partners are really, this is, I think, probably the core issue. It comes up in almost every meeting. And it's an issue for us even here at the state in terms of just, part of that great resignation. And I think it represents two things. I mean, it's just like who can do the work, but also I think some of the institutional knowledge that's like kind of walking out the door a little bit is I think hard to replace. So, I think that one of the things the state is thinking about is how we are, and let's even, for example, with motivational interviewing, right? Like as we are starting to introduce these pieces and we don't want to create unnecessary undue burden on counties, but like, how can we partner on training where there are opportunities, like people who've done it already, I think how can we make some parts of our system? I know that, our information system is certainly not robust. It is a system that was developed in the 90s and has been retrofitted many times. I think we're also working and listening to our counties around how we can ease some of the administrative burden so that we and have better systems across the county, apparatus and tribal apparatus to help support that. But it is a huge issue, and I think we're trying hard to listen and partner where we can.
I want to hear from both of you too, though, for this. So Suzanne, how are you experiencing that in Scott County? What are you guys looking at?
Yeah, I mean, it is clearly, it has been a sort of a blinking red light, probably in the previous couple of years from a child protection standpoint, really like 50% turnover. But with that, we have some stability for a moment. But I also think it has created some opportunities, and I don't want to like minimize the concern from providers. I mean, Joanna talked about access to treatment services. Well, the workforce challenges impact those services being readily available for families. And also, how do we get more creative? Because what I am a firm believer, services do not equal safety. And so how do we really engage in a meaningful way with families to know who are their supports in their informal networks to get them the support and the safety supports that they need to care for their family? Now, obviously there are critical service needs, but I think it's produced the opportunity to have different conversations as well.
Joanna, last but not least on this one, how are we doing with lawyers? Do we have enough lawyers? Are they burning out? What's the workforce situation with that?
You know, every lawyer in Minnesota, except those who work in Hennepin County, do this on a contract basis. So it's a really complicated, inefficient system that we utilize here from my perspective. We don't have enough lawyers in rural areas for either district court work, tribal court work, or appellate work. I think the centralized office for appeals is hoping to try to answer some of those questions so that attorneys in different parts of the states can handle appeals where you don't necessarily need to be on the ground. But similar to what Suzanne talked about in Barty, there are shortages with attorneys as well. And pay is a reason for that. Not having robust programs within law schools to train attorneys to do this work not being perceived as sort of interesting or high quality. It's like the lowest kind of lawyer when you come in the office. There's a lot of different issues that certainly affect people wanting to do this. And then there's just like the sustaining resilience and trauma that you experience. I mean, it's a hugely challenging arena of law and practice, and a lot of people aren't okay. They're not doing okay.
Yeah, no. Well, I want to thank you guys. We were over by a couple of minutes, so I'm going to thank Barty and Suzanne and Joanna for joining us for this really great conversation. I really appreciate your guys' time. Thanks to all the attendees. Sarah on my team will be sending out a survey just to ask everybody what they thought of the discussion, what we could have asked more about, what we could have done better, what they liked, all of those things. So with that, I will wish everybody a lovely afternoon. Enjoy the summer, but not so much today. Stay inside today, and then hopefully it'll be nice and sunny tomorrow. So thanks everybody for joining us.
Thanks. Nice to see you, Suzanne and Barty and John. Thank you.
Thank you, everybody.
Thank you.